Hello everyone. These are mean and bullous pemphigoid. Of us, we just memorize these things. These blisters have need to memorize other like diabetes, herpetitis, another bullous disease. So whenever you see any bullous disease, you should look for these things. The differentials you should look for. Let's start with the dermatitis herpetiformis. So blister disease. What is dermatitis herpetiformis? First, you should know that it is an autoimmune disease, as you can read it. But what you need to know more about this CD and DH? CD and DH. What is this CD? This is very, very important. CD and DH. Whenever you see this CD, you should memorize the DH. These two are combination factors, combination disease actually. So you need to memorize this CD. Whenever CD is celiac disease. If you are going through any gastroenterology malabsorption syndrome, you should know about the celiac disease. There is another autoimmune disease which affect the small intestine, especially duodenum and other. So this thing is very much important. Celiac disease is associated with dermatitis herpetiformis. So that's why whenever you just read CD, you should memorize DH. CDDH, CDDH. Every time you should memorize like that so that you cannot be missed any clues from here. So if there is any celiac disease, a patient suffering from diarrhea, steatorrhea, you can say, like steatorrhea, like pale greasy stool, and patient having weight loss, and patient also having some deficiencies like iron deficiency anemia, vitamin B12 deficiency anemia. So if these deficiencies of vitamins, this patient might suffer from dermatitis herpetiformis. You can that that's itchy. Itchy means so much pruritic, blister, and there is diarrhea. What is the diagnosis? Dermatitis herpes. You can diagnose within a second, itching, and there is diarrhea, like steatorrhea, pale greasy stool. So it could be DH. Another patient could suffer from any disease like malabsorption syndrome. Malabsorption syndrome. Then patient have iron deficiency. Iron deficiency. These two with itchy blisters or itchiness in this is dermatitis herpetiformis. So it's very much needed to know that CD is for DH. You should memorize the CDDH for whole this MRCP and also in PESES. So now dermatitis is an autoimmune disease, blistering skin disorder associated with celiac disease and caused by deposition of IgA in the dermis. More than 90% patient, this small bowel biopsy consistent with the gluten sensitive enteropathy. So this is also known as celiac disease synonym. So itchy vesicular skin lesion on the extensor surface, elbows, knees, buttocks. So extensor surface mostly. It is not mandatory that it should be in extensor surface. It can be in flexor surface. If there is any celiac disease present, that should be dermatitis herpetiformis, whether it is extensor surface or flexor surface. But most commonly it is in the extensor surface. We need to memorize this thing that extensor surface is most important one. If anyone said that I didn't describe it about that, but in flexor surface, do you know, in flexor surface of your hand or in the flexor surface of the body, if there is any papule means a macular change that can be elevated macule. So you can say that in papule. Elevated macule means just change in the coloration of the skin. So that is macule. Change of color of skin is macule. Papule is just elevated part of that macule, and it could be red erythematous. So that is papule. So itchy papule in flexor surface. What will be the clue? That should be lichen planus. We will read about this lichen planus. But if there is any itchiness and papule and pustule, then you should diagnose lichen planus. If there is any itchiness that come with the blister and extensor surface, like this one, extensor surface, so that would be dermatitis herpetiformis. So flexor surface, itchy pustule and papule rash, that is lichen planus. Lichen planus. You should answer this, lichen planus. Itchy blister in the extensor surface, dermatitis herpetiformis. So this short like presentation of disease only helpful for the your question answer. So this is so much needed in especially in dermatology. So again, in extensor surface, itchy rash, you might think this is dermatitis for herpetiformis. How can you be more 100% sure? If there is any celiac disease like presentation, and steatorrhea, any iron deficiency anemia, any osteoporosis. So you need to know celiac disease by whenever you read this dermatitis herpetiformis. So celiac disease complications you should know. Most important complication is iron deficiency anemia. Another thing, osteoporosis. So osteoporosis, iron deficiency anemia, having a itchy rash in the extensor surface, that is dermatitis herpetiformis. So I think these clues will be your revision part. Just you should revise your paper like this within this short form. Then you can revise whole medicine. So then we can go for further how you can diagnose it. So dermatitis, I said that CD, you should write DH in your paper, CD, DH. And also you should also know about the D, only D rule. So the D rule is direct immunofluorescence. You can see IgA, and D for the treatment is diet modification, like avoid gluten diet, gluten-free diet. So diet modification. Another is Depson. So you should know about D. So that is CDDH. So common rule is D. By D, you should memorize this. Direct immunofluorescence show IgA, and diet modification, Depson will be the treatment. So there will be, you can only, within seconds, you can just finish your dermatitis herpetiformis by write this 4 words: CD, DH, and 2D. You will got this point of question. So whenever you revise, how you will read CD, DH, and 2D. So I just want you to memorize these letters: CD, D, and 2. So how CD, celiac disease, it is associated with dermatitis herpetiformis, and 2D is, one is direct immunofluorescence test showing A, and another D is for diet and Depson. What is diet? That is gluten-free diet, and Depson is the treatment. So now anyone can just repeat it. So what will you remember only? Revise. Just only one who can just say these words: CD, DH, and 2D. What do you mean CD? Anyone?
Yes, CD is this celiac disease, and DH is dermatitis.
Celiac disease.
Yes. And
Am
DH.
I audible? Hello?
Yes. DH is dermatitis herpetiformis. And
Yes.
3D is direct.
Just
3D is direct immunofluorescence.
yes.
D, avoid diet, modification of diet, avoid gluten-free diet. Avoid gluten diet, and the treatment is Dapsone drug.
Yeah. Yes. Depson. Another clue you should remember what? That is extensor surface, you have itchy. Okay, now all of you can get this. The dermatitis herpetiformis, what you should remember these things. Okay, I will again ask you the CDDH and this 3D or 2D you can remember. Celiac disease is associated with dermatitis herpetiformis. And 3D, what is the direct immunofluorescence? Shows IgA, and the other D's are diet modification, and another D is Depson. You should remember the Depson. Okay. All right. So another thing I want to say about this Depson, if there is any hemolytic anemia, just you remember that this Depson can cause hemolytic anemia in glucose 6. Okay. Now, dermatitis herpetiformis, how we can say first gluten-free diet, if not working, then Depson. If Depson not effective, then what will you do? If Depson is not effective, there are some more advanced questions. Then you can go for oral sulfapyridine. This is newer question. That Depson is not effective, then how you can treat? You can go for oral sulfapyridine. This is very much important because in new pastors and past medicine, this is added. Previously, it was not there. So it should be memorized by everyone. So here is the lesions, that itchy lesions. Dermatitis herpetiformis. Vesicular rash, that is, there could be some blisters, intense pruritic, very itching. So now I want to just share one question to you. Can anyone read it? What will be the answer? If you read it, I can see that my network is okay.
Yes, a 32.
Yes, please.
A 32-year-old woman presents to her GP with a rash of several weeks across the elbow and knees. She also mentioned generalized tiredness. Blood tests reveal iron deficiency anemia. Given the most likely diagnosis, which of the following is an appropriate first-line option? Oral cetirizine, oral dapsone, oral prednisolone, topical clobetasol, and topical tacrolimus. Oral dapsone is the answer.
Yes, very nice. If there is first line is diet, avoid gluten diet. So it will be the first one then, not the Depson. Or if any medication they warrant, you can go for the Depson. Okay. If they put it both together, you can go for the avoid gluten. First line. Then second line oral Depson. Then you can go for third line sulfapyridine. Sulfapyridine you can memorize as an advanced option. So here there is no loose motion. No, there is no loose motion. But this patient having celiac disease because iron deficiency anemia. So you should remember CD, DH, and 3D. This is only division part. Celiac disease, dermatitis herpetiformis, and 3D. Direct immunofluorescence show IgA, granular appearance IgA, and D for diet, D for Depson. You shouldn't forget these things. Okay, just memorize these things. It will be helpful. I can give you 100% guarantee that it will be helpful. Only you can memorize it because you need to go for whole medicine. So that's why you need to memorize these things easily. And this oral Depson can cause hemolytic anemia, especially who are in glucose 6PD deficiency. So in hematology, it will be correlated that if any patient getting Depson, you can develop any type of hemolytic anemia like glucose 6PD deficiency hemolytic anemia. So just correlation would be present after full course. So anyone can say this, read this one. Which antibody you will prefer? Read it out rapidly. Hello.
A 34-old man present with a 3-week history of an intensely itchy rash just below his knees. On examination, he has a symmetrical vesicular blister rash and also some early lesions on the back of his arms. Which one of the following antibodies is most likely to be positive? Anti-mitochondrial antibody,
Anti-tissue transglutaminase.
anti-tissue transglutaminase antibody.
Yes,
The second
this is
is
the
right.
answer. So celiac disease, no? You
Yes, sir.
are familiar with the celiac disease. Very nice. So
Mm.
this is the clue. Whether you read this dermatitis herpetiformis a lot times, but you need to correlate with this CD, DH, and 3D. I think that would be better for answer. So this is the terms. For any questions you can get, you can answer right now. Okay, the answer is anti-tissue transglutaminase antibody. So no need to. This is the blister like dermatitis herpetiformis. In part two, they will give only this feature: a patient having this lesion and having itchy lesion. Sometimes they can give in MRCP part 2 that this patient having iron deficiency anemia or having celiac disease or having loose motion. So you can answer it rapidly by seeing this peak only. That is part 2. And part 1, only description of this will be given. There's the differences. So another blister form, I think dermatitis herpetiformis, you have no questions. This is the differences. I will not go for the bullous pemphigoid, pemphigus vulgaris. I will go for the other bullous disease right now. So dermatitis herpetiformis is very much important. CD, DH, and 3D. And in pemphigus vulgaris, you will know for that acantholysis, I have been said, acantholysis on biopsy, very much important, and flaccid blisters, which can be ruptured easily. So this is very important point. And how you'll treat, look, the treatments. So you should revise these differences: bullous pemphigoid, pemphigus vulgaris, and dermatitis herpetiformis.